Mr. Chao, you are the Health and Public Benefits Campaign Coordinator at the California Immigrant Policy Center. You work with the California Protecting Immigrant Families Coalition to provide access to safety net programs for immigrants in California. Thank you for joining us today.
Thank you for having me.
So, we have a lot to go over, so I want to jump straight into it. A major issue that immigrants commonly face is the lack of access to resources or programs that help improve their living conditions and overall situation. So, I guess our first question is, what are the major programs, opportunities, resources, or even policies that are missing and are crucial that we need to implement or invest more time into?
Great. Well, thank you, Kevin, for asking that question. It's a really important question because the heart of it really is, what are the ways that immigrants are excluded from um, the safety net that we provide to people in our state and in our country. And so at CIPC, addressing the exclusions that immigrants face in our safety net is one of our biggest priorities. And as you mentioned, um, I'm a part of CIPC's health and public benefits team. Um, one of the largest things, and this is really, this inequality was uncovered through our experience with the COVID-19 pandemic, is that immigrants have been excluded from public healthcare systems. Um, with our state's response to COVID-19, things like COVID-19 testing and treatment and vaccines are available to everyone, regardless of income or immigration status. But when it comes to long-term preventative care, not everyone can afford that. And so we know through our work at CIPC and through our conversations with, um, organizations that work with immigrant communities across the state, is that undocumented immigrants are the largest uninsured population, just category in the state of California. And so that kind of plays into our initiative, which is Health for All, which is aimed for several years to address the immigrant exclusion in our state's Medi-Cal program, which is California's version of Medicaid, um, uh, free to low cost insurance program for folks with low incomes, or people who qualify based off of their income. Um, that vision that we had in Health for All is extended into how we look at other issue areas, whether that's our food safety net. So programs like CalFresh and its state-funded counterpart, the California Food Access Program, also discriminate along the lines of immigration status. And so we launched a campaign this year called Food for All, which aims to address that inequality as well and remove that immigrant exclusion, so that immigrants who don't have the resources to provide, put food on the table every day, can do so without having to worry, in the same way that anyone else would be able to do so and go to a social services office and apply if they are a U.S. citizen or a green card, a permanent resident green card holder. Um, so I'll stop there to see if you have any more questions about that, and continue the conversation.
I would love to ask a follow-up. I know the state and the country was working very hard with marketing to get out the word that we do not check immigration status. But I do think there might be still some caution within the community in that area. I'm curious if California Immigrant Policy Center had anything to do with this. If you can maybe give us some insight on that, or any other issues that that the immigrant community is facing.
Mm-hmm. Yeah, I agree that there does need to be a lot of effort, and the state of California has been aware of that. I think the federal government is catching up, especially given that our last administration really tried to do the opposite. and try to discourage, the immigrant community from interacting with the government or accessing resources. That actually is at the heart of what I do in my role at CIPC, which is helping lead the California Protecting Immigrant Families Coalition. This coalition formed in 2018 in response to a regulatory change that the prior administration made to a statute called public charge. And so, just in essence, what public charge is that it's a means of inadmissibility or deportability that the USCIS, U.S. Customs and Immigration Services can use when determining whether to allow someone into the country or allow them to adjust their status. And it looks at whether that person will become a public charge to the country, meaning that they will rely on government benefits for subsistence purposes. And so what the prior administration did was change the rule, and this went into effect in February of 2020, so that a wider category of public benefit programs that are non-cash benefits, like Medicaid, like SNAP, Supplemental Nutrition Assistance Program, and others would be considered in this test. And this instilled a lot of fear in our community, who already were losing trust and interacting with the government, or maybe never had trust to begin with. Given the larger climate of fear, given that we had a president who was basically calling for communities at large to be removed from this country or painting them in a negative light. So what this public charge rule, which we now call the 2019 public charge rule, did was create a chilling effect. And this is what advocates refer to it, a chilling effect, meaning that people directly impacted by the issues feel discouraged accessing public benefits because they believe it will harm their ability to adjust their status or even pose an immediate threat to them and their family members. And this is something that I can personally attest to, because I used to be undocumented myself. My family is undocumented. And so just intuitively growing up, my mom would tell me, oh, don't, there's a time where after graduating, I wanted to apply for CalFresh with my partner, who is a US citizen. And my mom was telling me, oh, don't apply for CalFresh, don't share your information, because it may give you away or it can be used against you. And so I understand that fear, but advocates have been working really hard to address misinformation. And now that the rule has been reversed as of March 2021, we've returned to the 1999 definition of public charge, which only counts cash assistance for income maintenance and long-term institutional care. That means programs like Medicaid or Medi-Cal and CalFresh, WIC, et cetera, are unequivocally safe, safer to use. So we're trying to address that misinformation, repair fear, and employ trusted community messengers. And that might not always be an enroller at your county social services department. Maybe that needs to be someone who looks like you, someone who speaks the same language as you, someone who comes from the same region of the country you immigrated with. So there needs to be a diverse set of community members who are trained as community educators. And so that's part of the work that California Protecting Immigrant Families, or California PIF, has done, which is develop materials and flyers and digital tools to get the word out, and then trusted community messengers like promotoras, who are community educators, can build those relationships one-on-one with people in person, or maybe now that we've been in the pandemic for a while, doing that canvassing in other ways, whether that's digital or using things like different messenger apps and stuff like that, reaching people where they're at.
I think that's really amazing, the work you're doing. It's really important, and it definitely doesn't get as much attention And it definitely needs to be, not only does it need more attention, I also think that it just, more people need to be aware of how difficult it is and how many people it takes to actually, help these immigrants out. I do want to shift gears a little bit and talk about immigration policy and immigration in general. So, immigration policy and immigration, overall has just received a lot more attention in the last decade than it ever really has. What would you say are some of the reasons, whether they're good or bad, that have caused more people to have a real vested interest in immigration policy and the border crisis?
Hmm. I'm sure folks may have a variety of perspectives on this, but one thing I've heard from other immigration advocates, and maybe this is a bad reason why immigration has taken the stage, but there has been an increase in anti-immigrant rhetoric in the public discourse. So at the beginning of the 2016 election cycle, I'm not going to repeat what the past the prior president said, but he painted immigrants, especially from Central America, as being criminals and being detrimental to how he perceived America to be. And because of that, it enabled the sort of, in my opinion, the body of anti-immigrant sentiment in the country, and made some people feel more okay vocalizing maybe some negative perceptions they had about immigrants. And I want to say that California is not immune. In the late 90s, there was the whole movement around Prop 187, which, if it actually was implemented, would have severely, harmed immigrant communities in California. But at the same time, things like Prop 187 and the sort of unending barrage of anti-immigrant policies coming from the last federal administration, it mobilized people. And I started, working on immigrant rights before, during the Obama administration, when I was a student at UC Berkeley. And the issues that we talk about today were happening back then. But because the new, the news constantly brought up this discourse around immigrants and questions of, do they belong to this country? What should we do about our border immigration policy? Do we extend benefits? Do we continue excluding benefits to immigrants? More people became concerned and saw it as a priority issue. That's how, during the last administration in California, there was a huge upswell of pro-immigrant policies within the state. Because if you think about it, when you have a federal government that doesn't want to cooperate with, your vision for a more welcoming and belonging country, you work on any levers of change that you can get. And in California, given our demographics, we receive, a large portion of new incoming immigrants and refugees to this country. It was an easier sell, to our leadership in the state capitol. So we saw the California Values Act, which, in theory was a sanctuary law, which, messaging wise, shared this message that, yeah, ICE enforcement at large is not welcome in California. Of course, there were carve outs that still allowed cooperation between local law enforcement and ICE if you had a criminal conviction. So there are flaws in it as well, but also the passage of Health for All kids in 2016, Health for All young adults in 2019, which went into effect last year, which covers everyone up to age 26. And then this year, continuing that momentum, because of the pandemic, we passed Health for All older older adults, this was something that the governor and the legislature reached an agreement with in the last budget, which is to cover, one of the largest age groups, which is adults 15 up. So that momentum that we built in resistance to the prior administration is something that I hope we can continue. And just on the ground, more community education. It's just an opportunity. Whenever there is increased discussion, it's an opportunity to reach more people. And the organizers that we work with they deserve so much credit for actually educating people, changing hearts and minds, and building long-term power, which instead of just, reacting and being defensive against an aggressive an aggressive demagogue, we were actually trying to pose an alternative in California. And I hope the model that we have for state policy can be exported to other states. And we're seeing this in New York and also the state of Illinois, passed health for all older adults as well, though the age groups aren't identical. Or even our driver's license bill is an initiative that has been replicated in other states as well, allowing anyone, regardless of immigration status, to get a driver's license. So for me, what really opened my eyes during that time when immigration became a central issue and a highly politicized issue is that the state government is a really viable place to begin changing the way we talk about policy. And I think, as a native, as a person who grew up in California, it's like our backyard, so we can actually talk to these people. They're more accessible. And it's more accessible for our community members who want to engage in the political process.
Yes, thank you for sharing with us the incredible work that you've been a part of, and that the great strides California has made, and exactly, hopefully it can flow out across the country as well. Obviously, the pandemic, COVID-19, has impacted everyone, but also immigration and immigrants. I'm curious what challenges you've seen that have stemmed from the pandemic in the immigrant community.
Mm-hmm. There are two things that come to mind. One is just the disparate impact of the virus itself on the health of our communities, and the other is the economic impacts that have come with it, the economic downturn of the lockdowns. But I'll start with the health because that's more of what I've focused on in my work. We all want a buzzword that's become popular in the past year is essential workers. And we know that immigrants comprise a large portion of the essential workers in our state and in the country. I would even say are overrepresented compared to non-immigrants, just due to, if you're undocumented, you don't have access to the same quality of employment because of how you have to verify your immigration status with some employers. So if you think about our essential workers like farm workers who are continuing to produce the food that feeds this country and this nation in a pandemic and also an extreme heat wave, in the Central Valley, they're not, they don't have the same access to the same protections that we have, people who work at home have. That's an extreme privilege that I've had. Caregivers, another frontline worker, I have a family of caregivers. And so, when we think, that's something we highlighted a lot in our Health for All push, is that, immigrants take care of our elders, but who's going to take care of our undocumented elders? And given, that older folks are more vulnerable to COVID-19, we've also seen disparate impacts there. And and also restaurant workers. I think, line cooks, restaurant workers have seen some of the highest mortality rates when it comes to COVID-19 because of the risk of workplace exposure. And a lot of immigrants work in restaurants. I used to work in a restaurant myself before the pandemic. So all that to say, the impact of the virus has been hard in our communities, and so that has created a greater need for community outreach and education. Dispelling misinformation has been a key issue, and making sure that that information is available in languages beyond English, and also beyond English and Spanish. So imagine, like I just remember, for me, like when the pandemic started and lockdowns happened, I was like, how do I get an appointment to get tested? And it took hours to get tested at first before like infrastructure was built. And if you add on the barriers of language access and the barriers of like, okay, I'm still working because I'm an essential worker and I can't work from home or get sick time as easily, you're not able to get tested as frequently or have as much access, and in a systematic way that has caused the outcomes we see. And with vaccines, we've the state has a COVID-19 vaccine equity committee, and so CIPC has played a role in really telling the state administration, our public health department, that immigrant communities are a priority. This vaccine affects this virus affects everyone, but if we leave out immigrants from our vaccine plan, everyone will be affected. So our community partners like the Long Beach Immigrant Rights Coalition, which works out of Southern California, Civic, which is a Central Valley Immigrant Integration Coalition, they have been doing more of that work on the ground, and sharing with us what their findings are. I'm hosting webinars and videos on Facebook, ads, TikToks, whatever it takes, and also even hosting mobile vaccine clinics that people can go to. So that's one of the challenges, but we've been doing a lot of work, and this is something that might be worth another conversation. But vaccine access within detention centers as well is another huge issue that I wish I had more expertise to tell you about. But when we think about who's left behind, folks who are both undocumented and impacted by the criminal justice system, who maybe don't have access to adequate social distancing and hygiene, aren't getting the same access to the vaccine that we do, not being incarcerated. The other challenge is the economic well-being of our families and of our community. When it comes to federal stimulus, many immigrants categorically were excluded from the federal stimulus. Unfortunately, and the state has tried to compensate for that with things like the Golden State stimulus, $600 up to $1,200 one-time payments, but that doesn't even like come close to the amount of federal stimulus that some families have gotten. Not to say the federal stimulus was enough. I think it should have been more as well. But what got our communities at large through the pandemic is unemployment insurance. And undocumented workers don't qualify for unemployment insurance. So that is another barrier that immigrant families have faced when it comes to just holding through the pandemic. And so there's coalitions like the Safety Net for All coalition, which is continuously advocated for the past year for the state to come up with a solution and to set aside some money to prioritize workers who have been excluded and come up with an alternative there, because what we've provided so far isn't enough, to be frank. And so it seems like, at least in California, as we continue to improve vaccine rates will continue to reopen. Businesses will start re-energizing, and we're moving into this recovery phase of the pandemic. So, my fear is that all these lessons we've learned, all the rhetoric about, we're all in this together, High School Musical-esque, it stays. And we plan out our economic recovery in a way that is truly inclusive and doesn't just consider immigrants as a community as an afterthought. Immigrants make up what California is. 1 out of 6 children in California have at least one undocumented parent. So undocumented people are a part of the fabric of what California is, whether we like it or not. So when we talk about all Californians, we have to put immigrants at the beginning of the planning process, public policy wise, and bring them to the table as well, because they know their issues, better than some researchers do. They see it, they see it and live it every day.
Thank you for that. I think you did an amazing job of just like going over the pandemic and how it's affected so many families in California and also beyond. And I just think it's really impressive just how much work you've done. And it's also amazing that we have we're starting to see at least a few more resources than we did in the past for these families and individuals to actually get help. And for my final question, you kind of alluded to it at the end, but maybe we can go a little bit deeper. Just kind of like taking a step back and kind of looking at this topic from a broader perspective. What kind of developments do you think might happen in the coming years under the Biden administration and maybe even beyond? And what kind of developments would you like to see in the future in terms of immigration policy and the overall situation?
One that comes to mind, which is very timely, is the crisis over the DACA program. So at the end of last week, there was a decision from a federal court in Texas that placed an injunction on the DACA program. So folks who are applying to DACA for the first time are not able to apply for DACA, which includes people I know who have been in this country for decades. And just in the long term, the DACA program is in jeopardy. And these are people who are well integrated, worker, part of our workforce, part of the, family, their bread, they provide maybe the income to their families, breadwinners for their families. And largely folks who never were included in the DACA program when it was formed in 2012. And so there is discussion on the federal level of creating more pathways to citizenship for folks who we call dreamers, TPS holders, and essential workers. And there are various different proposals, but there seems to be some momentum in Congress around using the budget reconciliation process, similar to what we did for the American Recovery Act, to implement a pathway to citizenship and fix some of the gaps in the immigration system. So this is outside the scope of what we do at the California Immigration Policy Center, but it would highly impact what we do. Because if you think about it, if hundreds of thousands or millions of people in California get access to a pathway to citizenship, that also would allow them to qualify for federal safety net programs as well. And all the state funds that we use to accommodate for the exclusions that the federal government provides, we can reinvest to provide more resources for immigrant communities. And we can't undo the harms of the past administration. We can't undo the harms of this historical exclusion. But what we can do collectively is reevaluate our values. And I think the fundamental question is, who belongs in California? And for me, I believe that we are slowly helping people see that your immigration status does not affect whether or not you belong. And if you don't have, an authorized legal, if you don't have status, you still belong in California because you are here. You have been paying taxes. You are important to someone. You might be a parent, a friend to someone else. And as we've seen with the pandemic, your well-being is connected to my well-being. So that's kind of more of the abstract, philosophical question at the essence of this is who belongs, and then bringing that back to our more of the policy realm. How can we reflect that value we have collectively in our political process? So making sure that when it comes to our state budgetary process, we reflect that our budget is a statement of our values as Californians. So let's invest in immigrants, or even our local budgets, as well, in cities, and the policies that we advocate for, the reforms we advocate for, need to reflect those values as well. So yeah, that's what I'm hopeful for. Is we'll see what happens on the federal front, but all the power building and sort of consciousness raising that we've done in California, I think will take us to the future that we've been fighting for.
Thank you, Mr. Chao, for joining us today. I think your story is super inspiring, and it's just amazing how much work you've done. I'm sure the work you'll continue to do has impacted so many families in California, and probably even beyond. And like you said, a lot of the work done here in California might, hopefully be exported in the future to other states and to the rest of the country. So it's really, really inspiring to see just how much work you've done working for the California Immigrant Policy Center. So thank you for joining us today. I think this was, a really important discussion, and a discussion that really needs to happen more often.
Yeah, thank you, Kevin and Maddie. And thank you for inviting me. And I'm glad that at UC Riverside, this is something that you're engaging folks from all different sectors of policy. And I'm also a product of our public UC system. So I'm also happy to be a part of this process as well.
So I just want to take a few moments at the end of this episode to unfortunately announce that this will be Maddie's final episode as host of Policy Chats. She's been amazing on the podcast, and she's taught me so much. So Maddie, do you have some words for our audience?
Yes, thanks, Kevin. I'm so sad to make this announcement, but unfortunately the time has come. I graduated from the UCR School of Public Policy this past spring and was so lucky enough to continue my time as host through July. But this does mark my very last episode. I want to thank Dean Delalakar, Kathy Kim, Kurt Schwabe, Mark Manling for just trusting me with this podcast. It became the favorite part of my job, and I'm just so lucky to have had the opportunity to speak with so many amazing people and learn so much. So Kevin, you are the perfect replacement. I have every ounce of faith in you. You've been an amazing co-host these past few months, and I cannot wait to see where this podcast takes you and just the future of Policy Chats in general. So I will continue listening and watching, and I want to thank everyone out there for supporting us and tuning in every other Friday. And I wish everyone the very best of luck.
Thank you, Maddie. And I've learned from the best, and we can't wait to see what you do in the future as well.
Thank you.